Should you delay enrolling in Medicare if you're going to work past 65? That depends, and I'm going to tell you why in today's video, so please stay tuned. My name is Jamie from meetjamie.com. I'm an independent insurance agent. I help people understand how the Medicare program works, as well as find the coverage that fits their needs. A common question that I get both as a phone call and even on my YouTube channel is, what happens if I decide to work past 65? Should I or can I delay enrolling in Medicare without penalty? So there's a lot of factors that go into this decision-making process. And I'm going to explain some of those in today's video. So it's not an easy answer sometimes, but let's just start with the basics. First of all, it's important to remember that Medicare and Social Security are two different programs. They are very different programs. Their purpose is very different. A lot of people are going to delay taking their Social Security benefit so they can maximize that benefit by waiting until their full retirement age. That is many times a smart move to make. With Medicare, Medicare is health insurance that you are entitled to for most people at the age of 65. One of the common mistakes I see people making is, I'm going to work past 65, I'm going to wait until my full retirement age, and then I'm going to take Social Security and Medicare. Now, here's the thing. You should have a good financial planner that's helping you decide about when to take your Social Security. But Medicare is a completely different thought process that you have to have. And here's what I mean. A lot of people that I talk to, if I were to ask them, what is your health insurance like at work right now? They would just say it's pretty good. Right? They don't really know much about it, but they know that for the most part, when they go to the doctor, they go to a clinic, they're being covered. But that's not what I mean when I ask the question. What I mean when I ask the question is, show me your summary of benefits or outline of coverage with your employer plan. Because for me as an insurance agent, helping people find the Medicare plan that's right for them, I have to go over that with them. I have to explain to them, this is the plan, this is what it covers, this is how it works. So if a person calls my office or leaves a comment on a YouTube video and just says, yeah, I'm going to work past 65, so I'll just delay enrolling in Medicare, is that what you think? Well, here's the problem. Employer benefits vary greatly. Let me say that again. Employer benefits vary greatly. So if someone calls my office or leaves a comment on a YouTube video and just, randomly throws out the question, should I delay enrolling in Medicare? I can't really answer that. And quite honestly, you shouldn't be answering it either, unless you know exactly how much your medical insurance is going to cost you on that employer plan. There's no way to make an apples to apples comparison otherwise. You can't compare Medicare coverage if you don't know what you currently have with your employer coverage. I ask people this all the time, and now it's almost tongue-in-cheek. I say, do you know where your summary of benefits is for your employer plan? Do you know where your outline of coverage is for your employer plan? Most of them don't know. I'll ask them, do you know what happens if you go into the hospital and you stay in the hospital, let's say for 4 or 5 days? How much is that going to cost you out of pocket on your employer plan? They don't know. So there's no way that I, as an insurance agent offering Medicare health plans, can answer the question for them if I don't know what they currently have. And most people that I talk to don't know what they currently have. Now, I can tell you all about the Medicare program. I can tell you that once you're on Medicare, you're going to get access to the entire Medicare network in the country if you use traditional Medicare. That means that you can go to any doctor, clinic, hospital, provider that takes traditional Medicare. I don't know what you can do on your employer plan. I know that with traditional Medicare, 80% of your expenses are going to be covered, medically necessary expenses. I don't know what you have on your employer plan. I don't know how it covers. I know that you can get a Medicare supplement plan and pretty much cover the entire 20% gap of your 80% coverage from traditional Medicare, meaning that you are almost 100% covered for your medical. And that means if you go to the hospital, if you get cancer, if you have stroke, if you have a heart attack, that's what that means. But if you ask me, hey, should I delay enrolling in Medicare, and you don't know what your employer coverage is, and I don't know what your employer coverage is, I can't answer the question. See, a lot of people don't know this, but the average couple, once they're Medicare eligible, will face $350,000 of combined out-of-pocket medical expenses. And that has to be paid from somewhere. So either it's going to be paid with the current insurance that you have if you delay enrolling in Medicare, or it's going to be paid through your Medicare coverage. But ultimately, it is a financial exposure to you. And so in order to accurately decide, do I want to delay enrolling in Medicare, you have to know what you currently have. You have to know what the premiums cost you. You have to know what the co-payments cost you. You have to know what the maximum deductible, maximum out of pocket is for the year. Because all of those things are things that you are at risk for financially. Only then can you accurately say, okay, now let me turn my attention to Medicare and decide, do I need to enroll in Medicare, or is my employer benefits good enough that I can delay enrolling in Medicare? So there are a lot of factors to consider when it comes to deciding whether or not to delay enrolling in Medicare. There's other factors like, is your employer coverage credible? Again, how much is it going to cost you, which we already hit on in this video. So it's not a simple question that you can just answer on a whim. There's research that you have to do. There's an understanding of what you currently have compared to what you could have on Medicare. Don't make the mistake of saying, just because I'm going to work past 65 and delay taking Social Security, therefore I'm going to delay taking Medicare. Because it could be a financial, costly mistake. If you have other questions about Medicare, I'd love to hear them in the comments below. Otherwise, you can reach out to me through my website, which is just meetjamie.com. If you like videos like this, please subscribe to the channel, hit the like button, and pass it along to a friend. Thanks for watching. We'll see you in the next one.